it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a problem of middle age where you used to lose hair or have a thinning of hair or bald patchy hair. With increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and can be fixed by modifying to fixing our faulty lifestyle. Today, we have with us Dr. Rohini Soni is a well-known doctor based in Kashipur, Uttarakhand. She's M.B.B.S. MD in Dermatology. She also member of prestigious dermatology society like IADVL and ICSI. And she specializes in dermatology, cosmetology, and trichology. She's presently working as consultant dermatologist at KVR Hospital, Moradabad Road, Kashipur. Dr. Rohini has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized healthcare services to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets the individual requirement. Dr. Soni is aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Rohini, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Thank you. Thank you for welcoming me to this prestigious show. And I hope I put some information to the society while talking to you about the hair care.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So doctor, today we are going to discuss the hair care in current scenario. So whenever we talk about hair care in current scenario, the most common problem which is faced by all of us is hair loss, irrespective of gender or age. So doctor, can you let us know that what's normal and when to be concerned for?
Actually, hair loss is a very normal phenomenon which is going on in day-to-day life. But we don't consider it in a category of hair loss or alopecia when the number of hair fall is around 50 to 100, which is very, very normal. 50 to 100 loss of hair is normal in day-to-day life. But when we find that the hair fall which is coming is more than 100 and it is not coming back, there is miniaturization, there is thinning of the hair, miniaturization, there is bald patches are seen everywhere, then those are the conditions which are to be considered.
Okay, doctor. So hair fall is a normal phenomena, but when we see some abnormal thing like having a patchy hair, we should visit to the doctor.
Not only patchy hair, we see thinning, we see dandruff, we see some plaque-like thing on the scalp, or some thinning of the hair. Normal, the hair fall in day-to-day life, but when they're not coming back, we see thinning at that time, and we see some different changes in the hair texture, some frizziness. Then we have to concern the doctor.
Okay, doctor. So, doctor, why does hair loss occur? Like, what are the general causes of hair loss?
It depends upon the type of patients as well. In males, the causes of hair loss are quite different. Most of the males, that is around 55% of males, are having hair loss because of androgens, because it is known as androgenetic alopecia, where we see people in around the age of 20, there's a balding is seen in the frontal part of the scalp. There is temporal recession, that is the hair is going back, and the frontal hair, they are thinned out. This type of hair fall or the patterned hair fall is mostly seen in the males, and it is dependent upon the androgens they are having. The hair follicles are more sensitive to the androgens. That is why they are having it. And in case of females, as well as in general, we talk about hair fall, which is seen evenly throughout the scalp, is also known as telogen effluvium. It can be seen due to stress. It can be due to the overuse of the chemicals. It can be due to vitamin D deficiency, zinc deficiency, thyroid abnormalities, some hormonal abnormalities in females such as PCOS. There are many conditions that can lead to hair fall. Even nutritionally imbalanced diet, lack of proper protein intake can also lead to hair fall.
Okay, doctor. So there are like many causes and factors which influence our hair health. So, doctor, this come up to one question like, is health like lifestyle also play a role in hair health? Like in
Yes,
your
yes. Lifestyle plays a very important role in day-to-day life actually, because it directly influences the hair, it influences the skin. If we are good inside, we are having good skin, we are having good hair. If we are diseased, we're not taking proper sleep, we're not eating properly, it will show somewhere around the skin, around the hair. So it is very important to have a good lifestyle. We should take proper sleep with proper timing. 8 hours sleep is very good, and the balanced meals are very important. Nutritional deficiency should be avoided. Proper exercise should be done. All these can lead to a good skin, good hair.
Okay, doctor, very interesting. So, doctor, like now that we know the hair loss causes and other factors which influence the hair health, so can you please enlighten us today? Like, what are the medical treatment option available for hair loss, like topical or surgical or non-surgical, or is there some oral also which we can eat and manage our hair loss problems?
Options available, but people usually take this and that, listening from some friend, listening from some YouTube influencer or some otherwise people, and they do whatever they can do. But I think they should concern the proper person and then evaluate what is the cause which is causing them hair fall, because everybody is different, and the cause of hair fall in people are also different. It is not same in everybody, so treatment is different for everybody. Most of the people who are boys having androgenetic alopecia usually are given minoxidil. They are given some androgens reversing hormones, not reversing, actually reduction hormones, the androgen inhibitor hormones, so that the influence of androgen should not be present on the hair. They're also given some supplements. Most of the people are given some supplements because in Indian scenario, it is usually seen that either there is an iron deficiency which is causing hair fall, or there is vitamin D deficiency. Most of the females who are coming to me, 90% of them are having vitamin D deficiency. So invariably, without having a check, I usually give vitamin D to them, and it really improves their overall hair health and skin health. And apart from them, minoxidil in females is also very good. It is FDA approved. Then we give biotin to the patients in case they are having some kind of nutraceutical deficiencies. We also have evaluation of thyroid. People who are having thyroid abnormalities get very much great improvement after having thyroxine as a supplement. So depending upon the type of thing, we customize the treatment as well.
So the root cause of the problem is very important to get the treatment.
To identify the root cause is the most important thing.
Instead of buying online blindly and feeding ourselves and getting a result. So, doctor, like there is one word called nutraceutical, which is getting a lot of focus nowadays. So, can you please enlighten us, like what is nutraceutical and what is the role of nutraceuticals in hair health?
Nutraceuticals are very important these days because they are really giving a good improvement to the patients. Reason being that they have some effect that can lead to the decrease in the pro-inflammatory cytokines. So that they decreases the inflammation and they increases the growth factors in and around the hair, leading to the improvement in the overall hair health, the improvement in the texture, decrease in the hair fall. So long term, they are very good, but only treatment with nutraceuticals sometimes will not give you everything.
Okay, the combination is important.
Combination is important. But the best thing about them that they can be taken for the long time, okay, without having any very bad effects or whatever.
Okay, doctor. So, like, doctor, there are so many, herbal products, plant extract, phytoconstant used in management of alopecia. Can you let us know, like, what are some of them which is really important for the management of alopecia?
There are a lot of plant products, ginseng oil, some grapeseed oils are there, and then we have onion oils, sometimes used in alopecia areata, and some other phytonutrients, some capsaicin. There is a thing that can increase the the growth of the hair. There are very much peptides are available, flavonoids are available. The list is too long. It is not the short list to tell, but the overall effect of them, if given as an added treatment, is very nice.
Okay, so doctor, like, do these plant extract, like you said, grapeseed and like also one omega-3 fatty acid?
Omega-3, omega-6 fatty acids.
Yeah, so do they really promote hair growth?
Not directly they promote hair growth, but they are the antioxidants. They act as antioxidants. They decreases the inflammation in the body. They increases the release of growth factors from two cells. They increases the stem cells around the hair or the hair follicle. Overall, they promote our health. But if hair and skin are the reflection of health, actually, if we are in good health, then automatically everything improves. So that is why we say that nutraceuticals or some herbal products sometimes can have a good effect, especially by decreasing the oxidation and decreasing the having the antioxidants.
Okay, doctor, very interesting. So, doctor, like there are so many like macronutrients, micronutrients. So, doctor, can you like enlighten us today what is macronutrients or micronutrients and the role of micronutrients in hair health?
There are so many micronutrients available: zinc, selenium, even iron. The micronutrients are the things which are required in the few quantities, in the lesser quantities of the body. They are not required in the whole some amount. Macronutrients are like carbohydrates, proteins, and all that, which we get from the food. But sometimes micronutrients are not available because we eat so much junk. We don't take care of everything and this and that. There are so many long list of the products, long list of the micronutrients which are required for the proper regeneration of the new cells, proper hair growth, proper skin cycle, proper hair cycle. So zinc, selenium, magnesium, all these are the things which are to be taken as a supplement sometimes because we are not having proper food. Then they also help in the promotion of the overall health. But even if we take balanced diet, we take everything in small proportions, then overall supplementation is not required in that cases.
Okay, doctor. So, doctor, like, is it like required to take these nutrients as per gender RDA requirement, or we can just take it self-prescribe and take it blindly, like
nothing has to be taken as self-prescribed thing because a daily requirement is also known as RDA is very important. And it is according to the weight as well, according to the gender as well, according to the calorie intake we take as well, and body types as well. So everything has to be supplemented if given as per the doctor only, because we don't need too much of supplementation because of the diet, or if we take over supplement, hypervitaminosis is also a thing which can lead to the skin lesions, which can lead to the hair loss. Hyperselenosis is also a thing. Magnesium is also a thing. So everything has to be taken in proper quantities. It cannot be taken in the too much quantity that will lead to the actually have a anti or adverse effects of such nutraceuticals.
Okay, so taking them blindly can also lead to
And nothing should be taken blindly, and nothing should be taken for years and years to improve anything, because it will otherwise lead to some we have fat in our body, so everything we take in over supplements, they get stored in our fat and it will lead to the adverse effects either now or later.
Doctor. So, doctor, like after hair loss, another common problem faced by all of us is dandruff. So, does dandruff also cause hair fall?
Yes, not that much of hair fall is caused by dandruff, but it actually leads to flaking around the scalp, and the flaking, micro pitting of the cuticle, or the loss of the strength on the cuticle. This leads to the hair fall. And if we improve the dandruff condition, the flaking is reduced, the inflammation is reduced, automatically the hair fall reduces after that. So that is why it is said that always have a proper diagnosis that why you are having the hair fall. So yes, it directly or indirectly affects the hair health. It acts as a reservoir for the fungal thing to grow, and all these things will lead to hair fall. Even psoriasis is a condition which is quite similar to seborrheic dermatitis or dandruff. But the plaques in this case of psoriasis are quite thicker. In that case, also hair fall is quite in the thing seen in the such kind of patients.
Okay, doctor. So, doctor, like you earlier also said that lifestyle play a role in hair health. So, in lifestyle, one thing is stress, which is unavoidable. So, is there any impact of stress on hair health also?
Yes, stress is a condition which directly affects anything. Any health condition can get adverse with stress. So first thing is to be said that reduce the stress. If you have some exams, I know people are having stress-like conditions during exams. That is why it is always seen that females who are undergoing some exams will have a great amount of hair fall during that period. But later on, it is an acute condition. They improve by themselves, or they can take some uh, products as well or treatment as well to improve that. But stress directly plays a role. Stress is leads to the increase in the cortisol levels. Cortisol is a hormone that is also known as the stress hormone. It increases the cortisol level, and during that thing, every important nutrition is given to the important body parts. The nutrition to the hair, to the lesser important body parts is reduced. That is why it sometimes leads to hair fall. Plus, it increases the inflammation levels in the body. Cortisol increases the levels. That is why there is a hair fall after that.
So it's very important to manage the stress also, because stress can also lead to adverse health of hair. So, doctor, like when we are nowadays, like most of us also works from home, and whenever we are stressed, our mother, like हमारी मम्मी लोग कहते हैं कि अच्छा स्ट्रेस पे हो तो ऑयल का मसाज कर लो, और ज्यादा ऑयल लगा लगा के मसाज कर लो तो बाल भी लंबे होंगे, शाइन करेंगे, लंबे लंबे हो जाएंगे. So what do
I
you
think
think?
it is a myth. Oiling will not improve the hair health. It is just a myth. It sometimes also leads to the hair loss because the mummy will do chumpy and they will excessively pull the hair like this and like that. It will weaken the cuticle, it will weaken the hair follicles, and later on, after oiling, 2 days later, we start having hair fall. Plus, oiling will lead to so much of oil, and for the longer period of time, can lead to the growth of bacteria, can lead to the growth of fungi in that area. That will also promote the hair loss-like condition, and it also aggravates the seborrhea, that is dandruff-like condition. So oiling is not always good, but if people wants to have oiling, they can do it 15 to 20 minutes before having shampoo. Then they can have oil and they have to wash it out after that. Long period of oiling, so much of oiling will later on increase the hair. And in case of dandruff, we usually recommend that don't do oiling at all.
Okay, so people who have dandruff, they should try to avoid oiling hair. And what about the dry scalp people? Can they go for oiling?
Dry scalp is usually due to atopic dermatitis like condition. People who are having decreased production of sebum, they have dry scalp. In that condition, they have frizzy hair, they have dried out hair, they have the breakage in the hair is there. In that case, supplementation with omega-3, omega-6 is very helpful because these are the fatty acids which are required in the body to produce the sebum. So this is very helpful in such type of conditions. Apart from that, they can do oiling before having a shampoo, but prolonged oiling is never recommended. But the oiling can only improve the overall outer shininess or something like the overall frizziness can be reduced, but the hair health has nothing to do with the oil. Oiling cannot help you increase the hair growth or there is nothing like do oiling and you will have a good hair and have increased hair, the hair growth will be increased, nothing is like that.
Okay, so even
hair growth can only be increased with a good supplementation, proper we have to take care of the hair properly. We do not have to dry out our hair. We don't have to oil our hair so much. Everything has to be in proportion. Then there's a condition that is we reduce the hair loss and increase the growth.
So moderation is the key. So Doctor, can you give us some important tips for healthy hair today?
For healthy hair, the first thing has to be seen that there shouldn't be no condition which aggravates the hair fall. The conditions which do that are poor lifestyle. To improve the lifestyle, we have to have a good sleep. We have to have a balanced diet. Then we have to do some sort of exercise to increase the good health. Second thing is we have to rule out some conditions such as we should avoid. We should see that there should be no dandruff, no psoriasis, no atopic dermatitis. If we have that, we have to take treatment according to that so that the inflammation due to that decreases. Plus, we have to rule out that there should be no stress. The stress we cannot rule out completely, but we have to get ourselves somewhat relaxed so that the stress may not directly affect that hair fall like condition. And we have to see that hormonal influences, which is very, very important in males as well as females. In males, hyperandrogenism and androgens, they increases the hair. But if we do anything and we don't do anything about androgens, hair fall will continue. It is a progressive thing. Slowly and slowly, the frontal part of the scalp will go bad if we don't do anything. So we have to give some patients some finasteride-like things or dutasteride-like things, which decreases the DHT around the hair follicles and it increases the hair growth or promotes the hair indirectly. And in females, we have to decrease the imbalance which is formed due to PCOS-like condition, which is polycystic ovarian syndrome, which is very, very common these days. And we have to give them some sort of hormonal therapy to improve their overall cycles of the periods, to regularize their periods. As soon as they have a good regular cycles, the hair loss automatically decreases. We don't have to even give supplementation in that process. So depending upon the type of patients, the type of conditions, we have to customize treatment. We have to take care of our patients, their skin health, hair health. Everything has to be taken care, and not one medication can treat all.
Okay, doctor. So this discussion was very informative, and I'm sure our viewers would be benefited by it. So, doctor, can we take some live audience questions from our viewers? Okay, the first question is, doctor, I'm facing androgenic alopecia and the doctor gave me my vitamins and mineral supplements. Do I need to take them for whole life?
Vitamins and minerals are not to be taken for whole life. They has to be taken for 3 months, 2 months, depending upon the condition of the patient, or 4 months maximum. Then we have a break period for around 3 to 4 months, and then they can be again restarted. It is never that take vitamins for the whole life. It will lead to hypervitaminosis otherwise.
Okay, so doctor tells us that it is for this period, and after this
only for the period prescribed by the doctor. It is not that we take one prescription and take that prescription for the whole life. Never. It is never like that.
Regular follow-up is very important.
Follow-up is very important in every type of conditions.
Yeah. Another question from our audience is, hi Dr. Rohini, मैं भी उत्तराखंड से हूँ, मुझे एंड्रोजेनिक एरिएटा है, क्या मैं हेयर ट्रांसप्लांट करा सकता हूँ?
Depending upon कितना ज़्यादा इनको एंड्रोजेनेटिक एलोपेशिया है, if it is just the type 1 or type 2 like condition, which there is temporal recession or some frontal hair loss is there, then medication, other conditions like other treatment like mesotherapy is a condition in which we give the growth factors directly, injecting directly into the scalp, or PRP like condition like treatments in which we prepare the freshly prepared growth factors and then inject in the scalp. These are the treatments which help in type 1 or type 2 type of androgenetic alopecia. But in later conditions, when we have type 3, type 4, or the whole of the frontal baldness is there, then hair transplantation can be taken. And that also depends upon how much hair you have in the back or the occiput area. If you don't have hair there, then you have to take it either from the beard, either from the body. But you have to have hair in the body to create a frontal hairline.
Okay. Another question from our viewer is, doctor, before my pregnancy, my hair health was very good, but after pregnancy, I'm facing a lot of hair loss. So do I need to get it tested by a dermatologist?
Yes, actually, post-pregnancy or postpartum hair loss is very common and it happens to everybody. Some people have lesser hair fall, other have more. And it is mostly due to the stress condition we are facing in the body during the pregnancy and post-delivery. And in other cases, mostly it is due to the progesterone hormone, which is raised all over the pregnancy, and it leads to hair fall in few months after the delivery. So it usually happens around 2 to 3 months around the delivery, and post that there is increase in hair growth later on after 3 to 4 months. If it is not happening in 3 to 4 months, then you have to visit the doctor and consult about the condition.
Okay, so hair loss post pregnancy is a common
Very
problem.
common. It is very common, but if it is happening too much, you are going bald, then you have to visit early. If it is not controlled, if it is not reversing in 2 to 3 months after the delivery, then you have to visit.
Okay, another interesting question from our audience is, doctor, someone told me that lemon juice and onion juice लगाने से सर के आगे बाल आ सकते हैं, तो क्या मैं लगाना शुरू कर दूं?
It is a myth-like thing. I feel lemon juice and onion juice that doesn't have anything that will directly increase the hair growth, but they can act as an irritant. Irritant, in few cases, it can also lead to irritant contact dermatitis. Many of the patients come and they apply onion juice. Then they come with crusting and scaling like thing ke pata nahi kya ho gaya yahan lagaya tha. It is due to the irritant. It can lead to irritant contact dermatitis. But there are few studies as well which show that it leads to increase in the hair, but it is very difficult to comment that it will do something or not. I think it should not be done.
Okay, so like home remedies should not be done. It's
Home remedy should be avoided.
better to go to the doctor and get it done. Okay, another question from our viewer is, hi doctor, my son age is 15 and he's having gray hair. Why this problem so early? Do we need to take medication for this, or is this normal phenomenon?
It is not actually normal. This is known as premature tinnitus. Early graying of hair is known as premature tinnitus. It is usually due to deficiencies of many things. It can lead to it can be due to vitamin B6 deficiency or B12 deficiency, B3 deficiency. So list is very long. Can lead to graying of hair in the early age. Plus, genetics can also play a role. If the parents have early graying of hair, then it is very definite that the children will have early graying of hair. But in such kind of patients, improvement is seen, not 100% improvement, but taking calcium pantothenate and few topical medications are also available that will reverse the graying of hair. So patients should consider visiting the doctor.
Okay, so premature gray hair can also be controlled if we timely visit.
It can be controlled, but the treatment has to be taken for the longer period of time.
Okay, doctor. Okay, another question is, hi doctor, मेरे सर के आगे से बाल जा रहे हैं, तो किसी ने मुझे बोला कि मुझे मेल पैटर्न बॉल्डनेस हो सकता है, तो क्या मैं पीआरपी करा सकता हूँ? और उसने बोला पीआरपी बहुत अच्छा है, और कोई साइन एंड सिम्टम्स है मेल पैटर्न बॉल्डनेस का?
If the patient is male and there is a loss of hair from the frontal part of the scalp, it is usually considered as male pattern baldness or endogenetic alopecia. But definite diagnosis is made only by seeing the patient, because miniaturization of the hair is also being seen, and some other signs has to be seen while examining the patient. Then we can make the diagnosis. But PRP overall is a good treatment if the patient is having such a condition.
Okay, so doctor, can you enlighten us what is PRP?
PRP is platelet-rich plasma. We take blood from the patient's body. Around 12 to 20 ml of blood is taken depending on the amount of plasma we want to make. Then we put it in a machine, in centrifugal machine, and separate the plasma which is rich in platelets. That platelets inside the plasma releases the growth factors, which is injected in the scalp area, and that act as a very good hard or something like that, which increases growth. It is very good.
Okay. And it doesn't have any side effect.
No side effects except it is a mildly painful treatment because multiple injections have to be given on the scalp. Slightly painful, but the pain is all only up to the time of treatment only. There is no post-treatment pain or post-treatment swelling. Nothing is there. And most of the patients are very good. They're very happy with the benefits of the treatment.
Okay, interesting, doctor. Another question from a viewer is, Doctor, I got COVID in 2022, and since then I am facing a heavy hair loss. So is because of COVID or something is wrong in my body?
COVID in 2022.
Yes.
It is around 1.5 years the patient has been diagnosed with the COVID. In the initial period of time, it can be due to stress in the body. Post infections also there is hair loss, which is very, very common. But if the patient is having prolonged hair loss, then I think he should consider visiting to the doctor to rule out some other things. There may be some other things happening in the body because COVID 2 years back will not lead to hair loss now.
So does like viral infection can cause hair loss?
Viral infection, bacterial infection, typhoid, even some kind of surgical operations, they all can lead to hair loss. But the time period during which the hair loss is occurring is 1 to 2 months after the thing, but not lifelong hair fall will be there due to that. Even chemotherapy leads to very bad hair loss. Some medicines can lead to very bad hair loss. As soon as the medications are withdrawn, chemotherapy is stopped, hair comes back.
Okay. Another interesting question from our viewer is, डॉक्टर मेरे साथ एक एक्सीडेंट हो गया था जिसमें मेरे आगे के बाल जल गए थे, उसके बाद से उस पैच पे बाल ही नहीं आ रहे, तो मैं उसके लिए क्या कर सकती हूँ?
If that is the condition, some surgical thing is there, some scarring is there, then with medication the hair will not come back. The only thing in that case can be hair transplantation. 2 hairs have to be taken from the back side of the scalp and they have to be transplanted on the frontal scalp, will lead to the proper look. But otherwise only medication and some other sort of therapies will not cause improvement in that. So patch hair transplantation can be done for the smaller part of the thing can be done.
Okay, so patch transplant is also there.
There is a thing, if we want to improve the hair, the look of it is just a cosmetic thing. It is not that your hair is going to come back. It is a cosmetic thing that you are taking their hair from the backside of the hair and then transplanting that follicles inside the scarry skin, which does not have hair follicle left in that area. So if this kind of treatment will lead to the improvement in the cosmetic look of the patient and it will improve the overall condition. But otherwise, only with medication or some topical thing, the hair loss is not going to, the growth will not be there. This is not said to be as hair loss, it is the scarring-like thing which is happening after that.
Okay, doctor. Another very interesting question is, doctor, hair color करना क्या safe है और या फिर आयुर्वेदिक मेहंदी?
Nothing is actually good. Here, I can't say that junk food is good. So I cannot say that do hair color, it is very good. If you want to do that, it is okay. But otherwise, if you have a condition like hair fall is there, you have only ongoing hair fall is there. So at that time of thing, hair colors, even Ayurvedic medicine, because nothing is Ayurvedic these days, everything is chemical. And some kind of keratins, rebonding, smoothing, everything will worsen the hair fall you are having, right? So you should avoid doing such things while having hair fall. If you're okay, if you're good, then you can have it. But otherwise, I cannot recommend that. Have junk food daily, it is very good.
Okay, doctor, I'll just quickly take the last question because we are running out of time. And I think this question every female wants to know. Doctor, hairs पकड़ाने से क्या hair अच्छे और healthy grow कर सकते हैं और क्या heat treatment कराना safe है?
No. The one and only thing I can say is no. If you are having hair fall, then hair spa will not improve the health of your hair. It is just the you give conditioning. With the proper conditioning, you feel good hair. Yeah, you feel smooth hair for a few days after that. it is not overall going to improve the condition of the hair. If the condition is bad due to some condition in the thing going in the body, you have to improve that first to have a good hair or the growth back. Nothing otherwise can improve that. Heat treatments are very bad for the hair. Overall, they will increase the hair fall in the long run. And many patients have come to me, मैंने तो rebonding कराया था, तो मेरे आधे बाल रह गए. It feels very good at that time for 1 month, for 2 months. But later on, the overall health is bad for the hair because they are just pressing it so tightly again and again and again that the life in the hair is gone.
Okay, so any kind of heat treatment should not be done for our hair.
If you want to have a good look, it can be done for the temporary thing, but permanent changes will lead to the bad thing. The bad hair, it will lead to the bad hair.
Okay, doctor. So, doctor, would you like to give a take-home message or any other suggestion to our viewers today?
I will give few points. Just consider that for a good skin, for good health, for good hair, if you want everything to be very nice, shiny, and everything to be very proper, take proper sleep, take proper supplementations with recommendation of the doctor, take proper food, balanced diet, have a good exercise, and always go to the dermatologist or the doctor near you for having the diagnosis. Don't treat yourself. It will further lead to the problems and it will increase the period of time which will lead to the growth back. If you go early to the doctor, your diagnosis is early and your treatment is started early, you will get back to normal very soon. But when you increase that period, obviously the more time will be there to have a good improvement.
Okay, doctor, thank you so much, doctor, for sharing so much of information and all your expertise with us today and answering all the questions of our viewers. I'm sure our viewers have found this session very helpful. Thank you, doctor. It was a delight to have you and thank you for your valuable time.
Thank you for having me in the show.
Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma, your host, signing off for today. Thank you, doctor. Bye-bye. Have a nice evening.